Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery at Ease. Today I welcome you to another lecture in the series Radiology. Today we will be discussing the radiography pathology of cardiovascular system. Before going to the lecture, I want to highlight some things. We know that all of you who are following regularly that we actually first study the anatomy, but for particularly this class we will not be discussing anatomy in this particular class because I have discussed the heart vividly in the normal interpretation of the thorax lecture. Okay, I will give the link in the description. Before going to this lecture, do watch that video because many of the things, especially the how to identify different chambers and in lateral radiograph which chambers are visible, on dorsoventral which chambers are visible, and the clock face analogy, the vertebral heart score, all these things were detailed discussed in that particular video. That is the normal interpretation of the thorax when everything is normal. In this class we will be going to the radiographic pathology. If we will discuss the normal one, the class will be slightly longer because we already have to cover a lot of things. So do watch that video before this. Okay, let us go to our lecture. First watch that video, then this one, then it will be little bit helpful, or if you know something still you will understand this class. Okay, so first for radiography pathology we will discuss two things first. Okay, the chamber enlargement and the vessel enlargement. Okay, so these two things, this class will teach you how to diagnose the chamber enlargement and how to diagnose the vessel enlargement. By correlating these two, you can predict a disease, but the confirmatory diagnosis should always be done with echocardiography. Radiographic evaluation is not adequate for diagnosing the cardiac diseases. The best thing is echocardiography, okay, or ultrasonography. Then after you can relate this X-ray to further strengthen your report. Okay, so let us see for chamber enlargement. First one is the left atrium. The enlargement of left atrium is the most common one. So what are the causes? The most common cause is MMBD, myxomatous mitral valve disease, or simply you can tell mitral insufficiency. Okay, so what are the radiographic signs? First one is the loss of caudal cardiac waste. What happens in normal radiography? What you will find, here will be the carina will be like this. Okay, here will be the heart has a cranial border, then the caudal border. Usually the caudal border will point towards the carina like this, the heart will be like this. What is loss of caudal cardiac waste? It means it is particularly this portion, instead going towards the carina it will go up, or you can concave towards the caudodorsal margin like this. Okay, you will find a soft tissue opacity here. This is known as loss of caudal cardiac waste. You will find a concavity defect. Sometimes you may not find concavity defect, it may go straight up like this. We'll see some radiographs, don't worry. Next is dorsal displacement of carina. You know, if this will be enlarged, then obviously this will be dorsally displaced. Splaying of primary bronchi, it is viewed in DB or VDU. This particular phenomena is also happens in the tracheobronchial lymph node. I have already discussed the mediastinum. When the tracheobronchial lymph node will be enlarged, this particular sign will also be visible. Only the difference between this left atrial enlargement and the tracheobronchial lymph node enlargement is only evaluating lateral view. What happens when the left atrium will be enlarged? Usually you will find soft tissue opacity just below the carina or sometimes at the level of carina. Okay, but if it is heavily enlarged, then different thing. If it is normally enlarged, or you can say initial stage of enlargement, you will find like this. But the tracheobronchial lymph node, when it swells up in lateral radiograph, you will find a soft tissue opacity just dorsal, or you can say that caudodorsal to this particular carina. It is the only difference when they are mildly enlarged. If left atrium is highly enlarged, then it is very difficult to differentiate between these two. Okay, another thing in DB or VD view, if the left atrium is enlarged, you will see a circular thing. Okay, usually it will be very circular as compared to this mediastinum lymph node. We will see some radiographs also. Next is double wall effect. This particular double wall effect is seen when the atrium is highly dilated. We'll see radiographs. It is viewed in DV and VD view. You see, for evaluation of cardiovascular system, you need two views at least. One is the most diagnostic one will be left lateral, and DV. Okay, DV. These two will be most diagnostic one, because in left lateral we will be usually evaluating, very easily you can evaluate the cranial lobar vessels as well as heart, and DV view you will be able to diagnose the evaluate the caudal lobar vessels as well as the heart. Okay, if you will go for VD, then the caudal lobar vessels is usually not visible. Okay, you cannot evaluate them, and if you will go for right lateral, the cranial lobar vessels will not be visible. We'll see. Okay, we'll see. Next, left auricular enlargement. When there will be double wall effect or the left atrium is highly dilated, you will find it will push the left auricle to one side, or it can cause enlargement of left auricle. Okay, it is visualized at 2 or 3 o'clock. 2 to 3 o'clock. I have discussed the clock face analogy in normal thoracic radiograph class. Also, I will discuss mildly here also. So, it is present in DV and VD. In case of CAT, especially the left atrium enlargement is very less conspicuous. It means it is very less visible radiographically. Sometimes it may be visible, it may not be visible. Most of the time it is not visible. If at all visible, you will find the concave effect, like I told you here, and the important one is the DB one, where you will find Valentine shaped cardiac silhouette. We will see the picture. It actually looks like the the current generation Niba, the shape of heart, like this. It actually looks like this. Okay, we'll see. So let us go to our radiographs. So this is left atrium enlarged, I told you. So here can you see this particular margin, like this? It goes like this, goes like this. Okay, it should be going like this towards carina. Okay, instead it is going like this. Okay, so this concave surface is known as concavity defect. Okay, and you can easily see a soft tissue opacity here, which is can be said that the left atrium has been enlarged, especially in a lateral view. Let me show you some vessels. Why I told you. Can you see 4 vessels here? One here and one here. They are kind of parallel. Let me use another color. Sorry. And another 2 vessels. Here is one vessel and here is one vessel. Okay, the dorsal 2 vessels are the left cranial pulmonary vessels, while this black one, more ventral to this one, is the right cranial pulmonary vessels. Okay, so we usually evaluate the right cranial pulmonary vessel. For evaluating right cranial, you need a left lateral view. Why? This one is actually right lateral view. What happens? These vessels are intersected or interposed one above other, so you cannot evaluate. We'll see some left lateral photograph where you can evaluate especially the right cranial pulmonary vessels very nicely. Okay, this is the importance of left lateral view. Here, let me show you. You see the soft tissue opacity like this. It is severely dilated. Okay, this is concavity defect. Here you can find the concavity defect. Okay, can you see these 2 vessels? Here is one vessel, here is one vessel. This is left lateral view. This one is the left lateral view. You can see these 2 vessels. The cranial one, this cranial one is the artery. The 2 vessels are basically the right cranial pulmonary vessels. Sometimes they are known as parenchymal pulmonary vessels. Okay, so this is artery. Between the artery and this is vein. This is vein. This artery. Between the artery and vein, you will find a bronchus. So what happens actually, if this is artery and this is vein, the entire between the structure is not actually bronchus. Bronchus can be smaller or it can be slightly larger, but between them it's not actually entirely bronchus. This is anatomically you should No. So here this is artery and this is vein. The the cranial one will be artery, the caudal will be vein, or you can say dorsal one will be artery, the ventral one will be vein. Okay. So here can you see, whenever you will find left atrial enlargement, you will find the pulmonary vein to be engorged or dilated. You can see that between these two structures, here and here, you can clearly see that the vein is actually enlarged, while the artery is not that enlarged comparing to this size. Sometimes what will happen, artery will be engaged, vein will be normal. When there is inequality in diameter, it is very easy to diagnose which one is engorged and which one is not engorged. Okay, but when they are of same diameter, then you can take the measurement of fourth rib. Okay, if they are more than 75% of this fourth rib, then it is said to be engorged. If they are unequal, no need to take this measurement. Simply you can tell one is dilated or engorged or hypertensive compared to the other. Here the vein is engorged, especially in mitral insufficiency. You will find left atrial enlargement along with the pulmonary vein engorgement or pulmonary venous hypertension. Opposite to heartworm, in heartworm you will find right ventricular enlargement in with the pulmonary artery will be hypertensive. Okay, these two are the very common diseases. We will also discuss that. Okay, so this is lateral radiograph, this is DV radiograph. So in this particular DV radiograph, can you see a mass here, this mass effect here? Okay, so this is basically the left atrium. I want to highlight and see this particular enlargement is the left auricle. So what is clock face analogy? If I will make a clock face, okay, dividing in equal part of the heart, this will be 3, this will be 12, this will be 9, this will be 6. Okay, so what happens? This will be 1, this will be 2, 1, 2, 3, here it will be 11, it will be 10. If you are finding some bulge at the 9 to 11, this particular part, then it is the bulge of the right atrium. In some books you will find 1130 to 1230, or in some books, some articles also, you will find the reference between 12 to 1. If you are finding any bulge between 12 to 1, it is the bulge of the aortic arch. If you are finding any bulge in 1 to 2, then it is the bulge caused by the main pulmonary artery. If you are finding anything 2 to 3, then this is left auricle. Okay, here this mass is left atrium. Due to the mass, the left auricle, it is very difficult to say whether left auricle is enlarged or it has been pushed by the left atrium. Simply you can say that left atrium is protruding, so it might be enlarged or slightly displaced. Okay, so you understood the clock face analogy. I have discussed better in that video. And one more thing, can you see two vessels? Let me show you. Here is one vessel and here is one vessel. See this, I am underlining or bordering. This is one vessel, this is another vessel. Okay, the lateral one is the artery, the medial one is the vein. These are basically caudal, pulmonary vein, vessels. Okay, so this one is the right side, so right caudal pulmonary vessels, which are basically evaluated for a disease purpose. In left also you can, though it is not that clearly visible, but you can see a artery here and vein here, but they are not evaluated in the left side, only the right side is visible or evaluated. How it is evaluated? So what you have to do, you have to name the rib. Actually there is another one above this one, this is second rib actually, second, third, fourth, fifth, sixth, 7, 8 and 9. So what happens, these two arteries, vessels, artery and vein, will form a shadow or the intersection between the rib and this particular vessels, you will find a shadow. Here can you see a shadow here, one shadow, this is another shadow, this is another shadow. Okay, so what in this particular it is slightly enlarged. In computer while doing this you will have a better view. You can change the brightness also so that you can clearly view. So this particular thing you have to see if it is square. If this is a square, then there are three possibilities. It can be a square, it can be rectangular. So rectangle can be two. One thing like this, another will be like this. Okay, so if it is square, then everything is well and good. If it is rectangle and the long axis is perpendicular to the spine, then the vessels are engorged. Vessels are engorged or hypertensive or dilated, engorged. If the vertical axis is parallel to the spine, then you can tell that the vessel has been, the diameter is lessened. Okay, the diameter is less compared to the, or there is hypertrophy, or you can say that it is more constricted, whatever this thing. Okay, the important one is when it is engorged. Okay, so if you will see this one, okay, here they are kind of normal, they are almost a square. Okay, now this is how you have to engorge. We'll see some radiographs where the vein is engorged as well as artery engorged. We'll see some radiographs how they are thing. So I told you how they are evaluated. The caudal lobar vessel, the right caudal pulmonary vessels, or sometimes they are called the caudal lobar vessels. Okay, pulmonary lobar vessels. So here you can see that this is another radiograph. I told you about double wall effect. When they are severely dilated, you can see that this is the atrium which is dilated, and you can see the heart wall. This is wall of the heart. So you can see there is two, it seems like there are two walls. This is double wall effect. Okay, also the atrium is enlarged. You can see that, you can see here there is a bulge. If you will divide this one like this in the middle, okay, you can see that it is kind of 2 to 3. So this is left auricle is also enlarged, left auricle. Let me show you some vessels. Here the vessels are not that much visible. Okay, next, this is a radiograph of a cat. This is a radiograph of a cat. I told you in case of cat, left atrium enlargement is not conspicuous in radiography especially, but sometimes they are found. Especially you can see the concavity effect here. I told you about that one. And here is the Valentine shape heart. What happens when there will be bulge? Okay, the heart will attain a heart shape. There is another radiograph which is very much close to heart shape. Okay, if any radiology veterinary intern want to propose a radiology veterinary intern, female one or vice versa, they can give this radiograph. Okay, and one more thing, sometimes they are misdiagnosed that both the atrium has been enlarged, but usually it is only the left atrium which is enlarged, which produces the Valentine shape, and you can ask this question. Okay, left ventricle, the enlargement of left ventricle is very rarely visualized because it is a very thick one, very thick wall, and radiographically you may not find. I also searched some internet regarding the enlargement of left ventricle, but it's very less. Okay, so if the left ventricle enlarged, the whole heart will be enlarged. Okay, so if at all initially they are found, logically what will happen, there will be elevation of entire interthoracic trachea, more blunted cardiac apex. Of course the cardiac apex is on the left side, left ventricle. Okay, so it will be more blunt in VD and DB view, and around this left heart border usually everything will be round. Okay, in DB and VD view. Next is right atrium. The most common cause is tricuspid dysplasia. So what you will find, you will find a mass effect in the craniodorsal aspect, but same mass effect can be caused by aortic arch enlargement as well as main pulmonary artery enlargement or dilation. So how to differentiate? The differentiation can be made by the clock analogy. The right atrium, it will be enlarged at the level of 9 o'clock to 11 o'clock. Okay, let us see some radiographs, then you can appreciate. So this is the radiograph. This is a case of right atrial enlargement. Okay, in lateral radiograph you will find a mass effect. Here you can see that kind of here it has been enlarged, but this can be caused by the pulmonary artery as well, main pulmonary artery as well as aortic arch. But when you will go for clock face analogy, okay, if you will draw line, you can see that this particular portion is enlarged. Okay, so you can say that this right atrium is enlarged. Okay, next, the right ventricle, very important one. The right ventricle enlargement is much more noticed in heartworm disease. Okay, heartworm disease as well as pulmonary stenosis, heartworm disease. So what happens, radiographically we will find increased sternal contact. We'll see some radiograph, don't worry. What happens, the normal sternal contact will be 2.5 to 3 intercostal spaces. In deep chested breed it is slightly less, 1.5 to 2 intercostal spaces. In barrel chested it is slightly more, 3 to 3.5 intercostal spaces. So what another thing, dorsal displacement of cardiac apex. Of course, if at all you are not finding the sternal contact, or it is sternal contact is within the normal range, you may find that the displacement of cardiac apex. We will see the radiograph, reverse lateral D-shape right side cardiac silhouette. We will also see the radiograph of this one, but particularly regarding this one, it is said that this is, it should not over evaluate, especially this D-shape. It can be misleading. So, but you may think, if you are finding in lateral radiograph all those things, you can see this particular D shape in dorsoventral view. Okay, it will be protruding to right hemithorax because right ventricle is on the right side. So let us see some radiograph here. See this lateral radiograph. Okay, this is lateral radiograph. You can count the intercostal spaces. 1, 2, 3. This is 4. Okay, so the sternal contact is from here to here. So it is 4 intercostal spaces. Okay, normal is 3 to 2.5 to 3 or 3 to 3.5. It is beyond this one. Okay, so this is the sign for the right ventricular enlargement. Also, if the normal thing is there, the 1, 2, 3, which is normal, the sternal contact, but look at the cardiac apex. This is apex. Apex is dorsally shifted. Okay, so this is also, and you can also see it is kind of roundish, which shows that right ventricle is enlarged. Let us see some DV view. DV view. You see, this is a reverse D shape. Okay, this is particularly it is enlarged here. Okay, this is kind of D shape. Okay, it is D shape. So it is should not be over evaluated. First you have to do for the lateral radiograph, then after do the dorsoventral. Okay, if you will see the clock face analogy here, you can see that this particular portion is kind of enlarged. This is portion of right ventricle, and remember that this particular thing is enlarged, especially in heartworm disease. Heartworm disease. Let us see some caudal vessels. I told you, in case of heartworm disease, the pulmonary artery will be enlarged. Let us see, name the ribs. 1, 2, 3, 4, 5, 6, 7, 8 and 9. Can you see the vessels? Here is the artery and here is the vein. Okay, let me erase this one so that you can visualize. Let me erase this one. Can you see the vessels now? This is the artery, this is the vein. Let us see the shadow. Okay, let us see the shadow. Can you see the shadow here? It is kind of rectangular, where the long axis is perpendicular to the spine, while this one is kind of slightly, you can say that, but atrophied. It looks like atrophied, but it is kind of normal. Small variation is fine. And also I am drawing in a slightly bigger pane, so it might have some little bit of, what you can say, margin of error. Okay, but you can clearly see that the vein is, the artery is enlarged. If you will compare these two diameters, then you can clearly say that the artery is hypertensive, artery is inverse or enlarged. Okay, arterial dilation, and which coincides with the right ventricular dilation. So it might be a case of heartworm. Okay, these are caudal lobar vessels, caudal pulmonary vessels, you can say that. Okay, right hand side, not the left hand side. We discuss the chambers. Next go to vessel. So first one is caudal vena cava. Caudal vena cava, the size or diameter of caudal vena cava can increase when the central venous pressure increases, but it is not a reliable sign. Okay, so you can ignore this one. And even the vena cava has a very big diameter and it's a dynamic vessel also. Diameter of caudal vena cava can be estimated when it is, or you can say dilated, you can say it is dilated when the diameter is more than the length of body of L5 or L6. There is another method, it is more than 1 times the diameter of the descending aorta, but they are not much of reliable in nature, which can tell you about the increased venous pressure. Next is aorta. Aorta, I told you while I was telling you that the same sign will be produced by the right atrial dilation. Okay, so you will find the mass effect at the cranial aspect of cardiac cavity same as of right atrium, but in DV view the focal bulge will be at the 11:30 to 12:30. In somatically you will find 12 to 1. Okay, no problem, slight difference is there. So it will be in DV and VDV. So the conditions, the important one is patent ductus arteriosus. In that particular case, the aorta will be enlarged. One thing which is normal, but sometimes they are misdiagnosed as pathology, that in case of older cats, the aortic arch is usually not arch, it's a kind of vertical thing. We will see in radiographs, lateral we will find, and the descending aorta, especially the descending aorta, will be tortuous in older cats, comparing very straight nature in young ones. And also you will find a soft tissue opacity lateral to the mediastinum on the left side, which is basically nothing but the shadow created by the aorta. Okay, so sometimes they are misdiagnosed as focal long nodule. Okay, we'll see the radiograph, especially in DV and VDV. Let's see some radiographs. Here you see the mass effect in the craniodorsal border, mass effect in the craniodorsal border of the heart. Okay, this mass effect, same mass effect will be produced by right atrium dilation, and same effect will be found in main pulmonary artery dilation, but their presentation in VD and DV view will be different, especially in DV view. So here you can see, if you will do the clock face analogy like this one. Okay, this is 3, this is 12. Okay, 1, 2. Can you see a bulge here? Actually this is a bulge here. Okay, this is bulge. This particular bulge is between the 12 to 1. Okay, kind of 12 to 1. Major portion is in 12 to 1. So this is basically the aortic arch bulge. Okay, aortic arch bulge. Is vessel visible? No. And remember the vessels I told you about. This is right lateral. The crude as a parallel, you can see that the vessels are kind of, they are interposed, so it is not a right radiograph to evaluate the cranial pulmonary vessels. Okay, next, this is another radiography picture. You can see the bulge here and bulge here. Sorry, this is cat. I am very sorry, this is cat actually, old cat actually. See this abdominal aorta, sorry, the aorta. The aortic arch is kind of vertical, goes straight up, then it goes, and you can see that it is kind of tortuous. It is kind of tortuous. Okay, kind of tortuous. This is in normal in old cat. In DV or VDV, you will find a focal bulge, or you can say nodule type structure here. It is basically the aortic shadow. If you will compare this particular lesion in the lateral, you cannot find any nodule kind of here. Okay, so that is also a differentiating thing. Okay, so it is normal in cats, old cats. Is a vessel visible here? No, not that much. Okay, wherever the vessel will be visible, I will tell you so that you can remember things. Next, main pulmonary artery, the same mass effect, the left atrium, the right atrium, the aorta and the pulmonary artery in lateral radiograph will produce mass effect in the craniodorsal border of the heart. So this main pulmonary artery will be engorged in patent ductus arteriosus as well as pulmonary hypertension and heartworm disease. I told you heartworm disease. So the bulge will be between 1 to 2 o'clock in VD or DV view. Okay, and this particular enlargement is rarely recognized in case of cats. Let us see some radiograph. So this is the radiograph. We'll do the clock face. So this is So this is 3, this will be 12, 1, 2 and 3. You can see majority portion of the bulge will be between 1 to 3, 1 to 2. So this is basically bulge of main pulmonary artery. Can you see the vessels here? The vessel is not that clear, but one vessel is visible here. Okay, this most probably, usually the artery will be visible, okay, rather than the vein. Next is peripheral pulmonary vessels. Peripheral, or sometimes they are known as parenchymal pulmonary vessels. They are basically the cranial lobar vessels, cranial pulmonary vessels, and the caudal lobar or caudal pulmonary vessels. This can be left one or it can be right one. Usually the right one is evaluated. The right one. Best viewed in left lateral. Okay, right hand side. You see in left lateral, the left lung will be atelectic. Okay, so the vessels the lung which you will be evaluating very nicely is the right one. So it is in left lateral view, you will be evaluating the right side of hemithorax in better way. Inequality in diameter. If there is inequality, then you can easily say that whether the artery is enlarged or the vein is enlarged. Okay, when they will be equal, I told you, more than the 75% the length of the fourth rib. Okay, 1/3 of the fourth rib, 75%, proximal 1/3. Caudal lobar vessels, basically I told you that right hand side will be evaluated, not the left hand side. Best reviewed in DV view, I told you, in case of what happens actually. So this is thorax. So the vessel actually runs like this. Okay, so when it will be in DV view, the rays will hit directly to this particular structure, or you can say it will hit perpendicularly. If it will simply reverse, the vessel will become like this. So when the rays will come, it will come slightly parallel in case of VD view. So what happens? Due to this nature, the vessels will not be clearly visible. When they will be struck by head-on strike, then the vessels will be visible. That is why they are best reviewed in DV view. So inequality diameter, you can tell that which one is engorged. Summation shadow in the long axis change, I told you summation shadow at the level of 9th rib. Truncation or pruning, this is very important in case of heartworm disease. We will see some good radiographs. So in case of heartworm disease, what will happen? The pulmonary vessels, here will be heart and here will be the vessels. The lateral one is the artery, medial one is the vein. So what happens? Sometimes it will have some like this. Okay, it becomes truncate, or you can say tortuous. Okay, this is a sign of the heartworm disease. Sometimes what will happen, this particular artery will come and it will end abruptly. Okay, so what happens, it may be case of thromboembolism caused by the heartworm. When the heartworm dies, through vessels it goes up to the narrowest point and it can cause blockage. Okay, so this is very characteristic for heartworm disease. Let us see some radiographs. Here can you see some vessels? You see this is right lateral, this one is the left lateral, this left lateral. So what happens, you see here, can you see some vessels? Here is one vessel, one is vessel, one here vessel. So they are kind of interposed between them. Okay, one vessel here, one vessel here, one vessel here. So they are kind of interposed. It is very difficult to evaluate. The right and left, they are kind of interposed. But when you will take left lateral, you can clearly see those two vessels. Here one, here one. They are kind of normal. They have equal diameter. They are kind of normal. Okay. So if they are slightly enlarged, you can take, suppose 2, 3 and 4. This one is 4th rib. This will be the proximal 1/3. You have to take the measurement of this rib length or width of the rib. Sorry, not length, width of the rib. Then you have to calculate. It should be less than, in normal cases, it should be less than 75%. Okay, if it is more than 75%, then both of them are engorged. Let us see some other many radiographs are there. You don't need to worry. You just see this one. So here, can you see some vessels here? This is normal one. Here you see one vessel. Here is another vessel. Okay, they are kind of forming the square. Okay, so they are normal. In this particular case, this is basically zoomed view. You can see vessel here. Here is another vessel, and here is another vessel. This medial one, lateral one is the artery. Medial one is the vein. Between them will be a bronchus. Okay. So this is basically the caudal lobar vessel or caudal pulmonary vessels. This is another view. You see these two vessels. This is artery, this will be vein. When the bronchos will be very much concentrated, they can be slightly nearer. Okay, both artery and vein. So here you can see this artery and then very near to the vein. They are equal in diameter, but if you see the rib, suppose this is second, third and fourth, you can see that they are nearly 100%. Okay, the rib length nearly 100%, nearly 100%. So it means both of them has been engorged. Okay, here you will see the caudal one. Oh, this in this particular you can clearly see the artery vein very nicely. So this is one is the artery, here is the vein. Okay, let us see. This one is first rib, second, third, fourth, fifth, sixth, seventh, eighth and the ninth. Let us see some shadow. Here you can see this shadow. It is kind of rectangular. Vein is also rectangular. The vein is kind of more enlarged or more engorged than the artery, but both of them slightly engorged, saying that or seeing that both of them the long axis is perpendicular to this particular spine. You see also the heart is kind of very much enlarged and it is globoid in space. It might be a case of heart failure. In that particular case, both artery and vein, both of them will be have hypertension. Okay, they both will be enlarged. We'll see. This is a case. This was a case of I think pericardial effusion. We'll see some radiographs and the cases also. Okay, let us come into specific disease. I was talking about cases. First one, the heart failure. Here I just wanted to highlight the things. When there will be left hand side heart failure, we will find pulmonary edema. Okay, when there will be right hand side failure, we will find pleural effusion. Okay, these two I wanted to highlight. Okay, so in left hand side failure, you know, in case of dog and cat, the most common cause is the mitral insufficiency. The right hand side failure is, you will see the disease which affects the right hand side is the heartworm disease. Okay, so then in later stage of mitral insufficiency, we will see pulmonary edema. We have some radiographs, and in case of heartworm disease in later stage, you will find pleural effusion. We also have radiograph. Okay, by seeing the radiograph, then you can understand it better way. First one is most common disease in case of dog and cat is the mitral insufficiency. Okay, so you will find two signs you have to remember: left atrial enlargement, pulmonary venous hypertension. These are very much characteristic which can be easily diagnosed from the radiograph. Otherwise, you can go for echocardiography. They are the best. Apart from that, when they are not treated for longer time, then the ventricular enlargement will be there and pulmonary artery will be hypertensive. The last stage is pulmonary edema. Okay, let us see some radiographs. This is the case of mitral insufficiency. You can see the vessels. Okay, these two vessels. Here I told you this one, I think the right lateral, because there is another vessel here. Okay, they are kind of superimposed, but the caudal one, they are basically the right lobar. The dorsal one will be the left vessels, left side vessels. The ventral one will be the right side vessels. By that you can evaluate. It is better go for the left lateral view. You can see the left atrial dilation also. You can see here left atrial dilation, concave effect, and instead of going towards the carina, it goes up. Okay, there is a mass effect in the caudo-dorsal border of the heart. Next here, see, this is also a case of mitral insufficiency. You can see this is artery, this is vein. You can clearly see that vein is engorged. Okay, in case of mitral insufficiency, pulmonary venous hypertension as well as left atrial enlargement. You can see the left atrium here, left atrial enlargement. Okay, concavity effect here, and instead of going towards carina like this, it is going up. Okay, you can, if you will see the tracheal bifurcation, one of the bronchos is actually kind of constricted. Okay, here one bronchos is visible. Normally they are not visible. You will only find up to the carina. Okay, so this is left atrial enlargement and the pulmonary venous hypertension. These two are very much of characteristic. In DB view, I told you, you will find a mass effect at the center. This mass effect. Okay, and if you will see the vessels here, the vessels are also visible. You can see a vessel here and you can see a vessel here. You can clearly see the vein is enlarged. Okay, pulmonary vein is enlarged. Next, See, this one is, this radiography you have already seen. Okay, here is the mass effect caused by left ventricular, left atrial dilation, and this is the left auricle bulge. Okay, left auricle. And see the vessels here, see the vessels here. Can you see here? This is one vessel, I'm sorry, this is one vessel, this is one vessel, this is another vessel. Vein is slightly more in width than the artery, but it's all right. Okay, it might be a case of both might be enlarged. Okay, last stage. Here see another radiograph. There are a lot more radiographs, different type of radiographs you can enjoy. Okay, you can see this is the concavity effect. Okay, I told you this is concavity effect. And see the vessels here, kind of normal, the cranial lobar vessels. Okay, cranial lobar vessels. This is the mass effect, double wall effect. I told you when the left atrium will be enlarged. All these are cases of mitral insufficiency. In mitral insufficiency, first is the left atrial enlargement, venous hypertension, pulmonary venous hypertension. Okay, this one is the mass double wall effect, severely dilation. Next, see another radiograph here. See here, this is the artery which is kind of thin, while the vein is kind of enlarged. I told you in mitral insufficiency, you can see that here the concavity effect is not there, but it is going straight dorsal. Okay, instead of it should be going like this, it is going like this. Left atrial enlargement is there, and see this mass effect. Okay, left atrial enlargement. Here the in review view, it's kind of globoid, so there it might be a case of all the four chambers has been enlarged. Okay, let us see some vessels. See this artery here, this one is the artery. See the vein is kind of enlarged. Okay, compared to the size of the artery, the vein is enlarged. It is a case of mitral insufficiency. Next, here you see some radiographs. This is lateral radiograph. You can see this artery is here, vein is here. Vein is kind of enlarged. Okay, cranial lobar vessels. Okay, right cranial lobar vessel. Another radiograph, and not another, this one is zoomed one. This is the artery, see the vein. Okay, the vein is enlarged. This is a case of mitral insufficiency. Another radiograph here of mitral insufficiency, because it is a very common disease, I have included much radiographs so that you can see. Okay, see here, the vein is kind of enlarged, artery is kind of very thin. Okay, though it is not that much clear, but you can say from this one. And remember the atria enlargement, it goes straight up rather than going towards the carina like this. It is going straight up. Left atrial enlargement, vein is also enlarged. In case of dorsoventral view, here the vessels are not visible, but notice the opacity of this particular lung here and opacity of this particular lung here. Okay, and compare it with the caudal lobes here. Caudal lobes here. You can see that the opacity of this particular caudal lobes kind of hazy. Okay, kind of hazy. You can say that there are different lung patterns, interstitial pattern, bronchial pattern, okay, alveolar pattern, like that. There are different patterns. I will discuss in the next class, which is the last class. So in that particular class, I will discuss. It is kind of interstitial pattern. Okay, it is much more pronounced in case when there will be soft tissue opacity. Okay, lungs will become soft tissue opacity. You can see that soft tissue opacity here and there. It is a sign of fluid accumulation. Okay, pulmonary edema. So in mitral insufficiency, there will be left hand side failure. When left hand side heart failure will be there will be first sign will be pulmonary edema. Okay, last it will be pleural effusion, but first it will be pulmonary edema. So you can see that there is some pulmonary edema, but also you can see that there is pleural effusion, slightly pleural effusion, very mild actually. Can you see you can see a section here. Okay, you can say that interlobar fissure. I told you about pleural effusion. Okay, I have discussed in pleural space. So there is a visibility of the fissure, visibility of fissure. So this can suggest that there might be slightly pleural effusion. Okay. Here there is something, can you see this one? Actually this is not pleural fissure, this is the cranioventral reflection, okay, of the mediastinum. This is a zoomed in view, you can see this is the fissure, and you can see that this caudal lobe, especially this caudal lobe, cranial, this one caudal lobe, you can see that it is kind of hazy, which suggests that pulmonary edema. Let us see another radiograph. Sorry, finish. Next, heartworm. Heartworm, two signs: pulmonary arterial hypertension, right ventricular dilation. These two are very, very important. Other than that, all main pulmonary artery, they will also be dilated. Okay, peripheral, focal, multifocal, alveolar pulmonary pattern. It happens alveolar pulmonary pattern. What happens actually when the heartworms? These heartworms can die. When they die, the smaller one, they will go to end arteries of the pulmonary artery. So what happens? They will cause thromboembolism. Due to thromboembolism, this alveolar pulmonary pattern will be there due to necrosis. Okay, we will see that. This is also a suggestive. If you are finding pulmonary arterial hypertension, main pulmonary dilation, right ventricular dilation, as well as alveolar pulmonary pattern, it is a case of heartworm disease. Okay. Also, it is bilateral pleural effusion. I told you, when there will be right hand side failure, you will find pleural effusion. Let us see some radiograph so that you can appreciate. This one is the radiograph. The radio opacity here is actually a microchip. Okay, it is not any pathology, it is a microchip. You see here, the artery is here and the vein is here. You can clearly say the artery is enlarged. Pulmonary artery hypertension. Again, you can say that left atrium is also enlarged here, and you can see that this apex, this particular apex, I told you, in right ventricular enlargement, the apex will be dorsal displaced. You can see that it is kind of dorsally displaced. One more thing you have to take note, that in left lateral view, apex is slightly displaced. Okay, it can be slightly, but here is considerably displaced. And let us calculate the intercostal space. 1 2 3. Okay, kind of normal, but the thing is, it is the pulmonary artery is enlarged. And I told you about the alveolar pattern. Okay, see this caudal lobe, this particularly caudal lobe here. Can you see that it is kind of hazy, and you will find soft tissue masses here, something. Okay, soft tissue patterns, which is kind of more pronounced than the previous one. Okay, so in the previous one, I mistakenly, actually now I realize I told you interstitial, but they are not, they are also alveolar type pattern. Okay, so this particular thing, especially in this caudal lobe, can be suggestive of heartworm disease. Let's see in the ventral dorsal view, sorry, dorsoventral. See here, this is the heart. See this bulge. If we will do the clock face analogy like this, we will do the clock face analogy, equal part 12 3 1 2 3. It is between, the main part is between 1 to 2, that is the main pulmonary artery. If it has been here, then it would have been aortic arch. Okay, so the main pulmonary has been dilated, and also right ventricle has been dilated, shifting of the apex, and also the pulmonary artery is enlarged, the cranial one. Let us see the caudal one. I told you about truncating or pruning. Okay, you can say that the vessels will be kind of tortuous. Can you see the artery here? This is artery, it is kind of tortuous. You see here. Okay, it happens due to thromboembolism. Okay, here this structure is not the vein, or you can say that the caudal lobar vein. This is caudal vena cava. Okay, this structure is, let me erase this one for you so that you can see that this is caudal vena cava. The vein here, it is very small here. Okay, so this is caudal lobar vessel, artery, and this vein. Artery is enlarged as well as tortuous, which is characteristic to heartworm disease. Okay, and here what you are seeing is basically the caudal vena cava. Okay, so this is heartworm disease. Let us see some other radiographs also. Here is another radiograph. You can see the artery highly engorged. Nearby to that, this is vein. Okay, this is heart. There is a bulge here. You can see this bulge. Okay, main pulmonary artery bulge. If you do the clock face analogy, 1 2, it is between 1 to 2. So this bulge is basically main pulmonary artery bulge. As well as you can see that the artery, pulmonary artery, especially the caudal lobe. In DB view we are evaluating the caudal lobe. So this particular artery is kind of very much enlarged compared to the vein. This is a suggestive of heartworm disease. Next, this is a radiograph of heartworm disease. You can see that this artery is enlarged here. This is vein nearby to. This is the enlarged view. You can see this artery, pulmonary artery, is kind of very much enlarged nearby to that vein, which is kind of normal. And this is DB view. Okay, this is DB view. And here you see the, sorry, this one is the VD view. This is the actually DB view. I am really sorry. See this artery. Here the artery is very much enlarged. Nearby to that is vein, which is kind of thin. Okay, here is the better view. You see that this is the artery, this is the vein. Vein is kind of normal while the artery is enlarged. This is the VD view. In VD view you cannot evaluate the vessels. You see these vessels are not visible nicely, while the same radiograph in DB view the vessels are evaluated very nicely. So you have to, for evaluation of cardiovascular system, left lateral and the dorsoventral, these two views. Next, see this one. This one I told you that sometimes they end abruptly. So this one actually the artery and it has ended like this. So this happens when there will be thromboembolism due to the heartworm, dying heartworm. Okay. Next, the cardiomyopathy. These two, the left atrial enlargement, that is mitral insufficiency, and heartworm disease, these two can be diagnosed from radiography. Okay, can be, but should always be confirmed from the echocardiography. That is the last or definitive diagnostic tool rather than the radiology. Radiology can support your inference. Cardiomyopathy, they are not readily diagnosed from the radiography, but you can find some lesions like generalized cardiomegaly. Okay, left atrial dilation, they are not that much conclusive. Okay, pulmonary vein dilation, parenchymal pulmonary artery dilation, possible pleural effusion, then when there will be right hand side heart failure. Sorry. Okay, this is a case of cardiomyopathy. Can you tell what happens here? What are the pathological signs? There is actually pleural effusion. Okay, here you can see a fissure here, and you can see the scalloped margin of the lungs. This is scalloped margin, retrosternal opacification. They are very characteristics of pulmonary, the pleural effusion. Okay, there is pleural effusion. It means the heart has failed actually. So here you can see that this is the dorsoventral view. We can also see that this is hazy, which is basically the pulmonary edema. Okay, this can be symbol of pulmonary edema. You can see the fissures. Here is one fissure, here is another fissure. Okay, visibility of these fissures are basically the symbol or sign of the pleural effusion. Okay, let us see another radiograph here. I told you about the Valentine shape. Okay, so this one is a case of cardiomyopathy. In case of cat, you can see that you are finding a slightly concave defect which is consistent with left atrial dilation. In case of cat, left atrial dilation is very difficultly recognized from the radiograph. And here you see the Valentine shape. This is much better Valentine shape. Okay, oh my god. Okay, keep this radiograph and give it through your radiography pattern. Okay, who said that the heart shape is something other? It can be the heart shape. Okay, so next is pericardial effusion. Pericardial effusion is also cannot be diagnosed from the radiography conclusively, but it can support something. It is the ciliary will be globoid, circular, globoid cardiac ciliary. Severely affected cases, the ciliary may touch the thoracic wall bilateral. We will see some radiographs. And the pleural effusion will be of right hand side heart failure. You see here this particular radiograph, the heart is kind of globoid shape. Okay, in dorsoventral view, You can see that the heart is kind of attaining globoid shape. Globoid shape. Here you can see that vessels, both the artery and as well as the vein, both are engorged. Okay, both are dilated. This is basically the and I told you they are touching the thoracic wall margin in both sides. Okay, this is basically pleural effusion, but they are not conclusive from the radiography. You can simply write the signs. Okay, then you have to do echocardiography to support those findings. Patent ductus arteriosus, this is a congenital anomaly. Okay, so patent ductus arteriosus means it is a basically connection between the aorta and the main pulmonary artery. So if it is patent, then both the aorta and main pulmonary artery, they will be enlarged. Okay, this is the sign of patent ductus arteriosus. Arterial aortic arch dilation as well as the main pulmonary artery dilation. So these are the additional left arterial dilation, left ventricular dilation, parenchymal pulmonary vessel hypertension. Let us see some radiographs. Okay, here see the radiograph. This is the heart. Okay, you see two bulges here, one bulge here, one bulge here. This is the bulge of the aortic arch. The nearby will be the main pulmonary artery. Can you see vessels? Here is one vessel, here is another vessel. Okay, they are both engorged. Here see the both artery and the vein, they are engorged. This one is the cranial lobar vessel, they are the caudal lobar vessel. They are otherwise also known as the caudal pulmonary vessels. This is cranial pulmonary vessel. They both are of right hand side. Okay, they both are engorged. How to do this? Suppose 1, 2, 3, 4. Not this will be 2, 3. This is 4th rib. You can see this measurement. You can see that they are kind of similar to this one. It should be less than 75% to be normal. If it is more than 75%, it means it is abnormal. Okay, or it is engorged. This is also a case of the patent ductus arteriosus. You can see two bulges here. This is one bulge. This is another bulge. Okay, so these two, when you will find two nearby bulges at this particular position between 12 to 2, then they are basically the bulges of the aortic arch and as well as the main pulmonary artery. Here another radiograph. Okay, so this is heart. There is also left arterial dilation, and you can see this mass effect here. Also when mass effect is due to the dilation of aortic arch as well as the main pulmonary artery, both of them will produce this mass effect at the cranio-dorsal border of the heart, and also ventricle is slightly dilated. You can see there 1, 2, 3 and a half, kind of it is coming towards the 4. Okay, so left ventricle is also dilated. Okay, and in dorsoventral radiograph, can you see two bulges? It is one bulge and here is another bulge. Okay, this bulge is not that prominent, especially the main pulmonary artery, but the aortic arch is kind of prominent. And also see the vessels, they both are engorged. Here is one vessel and here is another vessel. They both are engorged. Okay, hypertension. Next, the pulmonary stenosis. They are better diagnosed echocardiographically. In case of pulmonary stenosis, the vessel is main pulmonary artery. So you will find dilation of main pulmonary artery. When main pulmonary artery will be dilated, right ventricle will be dilated. Okay, because the main pulmonary artery comes from the right ventricle. So here you can see this costal attachment. 1, 2, 3, 4, kind of half, 4 and a half. Okay, ventricle is enlarged. In DB view, you can see this bulge here. Okay, this is basically main pulmonary artery bulge. And if you will see the vessel, you see this big vessel is the vena cava. This one is the vena cava. Near to the vena cava, you see these two vessels. Here one vessel, here one vessel. This is one is the artery, the lateral one, medial one is the vein. Okay, nearby to that vena cava. Vena cava is kindly very weak. Okay, in diameter wise. So this is pulmonary stenosis. Next is aortic stenosis. This is the last disease. So it is aorta. So there will be aortic dilation. When aorta arises from the left ventricle, so left ventricle will be dilated. And when ventricle will be dilated, arteria will become dilated. Reverse thing. Okay, and pulmonary venous hypertension. Reverse thing. So you will find, I told you, when the aorta will be enlarged, you will find cranio-dorsal aspect, mass effect in the cranio-dorsal aspect. And can you see here, this is actually the heart margin. this one is the heart margin. In this particular is of fat opacity, basically pericardial fat. Okay, pericardial fat. You see the bulge here. This is aortic bulge. Okay, so this is basically also the left atrium is enlarged here. Left atrium, instead of going towards carina, it is slightly going up. Okay, so this is left arterial enlargement. So this is basically the radiography pathology of the cardiovascular system. From this, simply you have to diagnose which chamber has been enlarged and which vessels are enlarged. From this you can at least diagnose two diseases conclusively, slightly. Echocardiogram is always better, that is the mitral insufficiency and heartworm disease. Okay, in mitral insufficiency you will find left ventricular or left atrial enlargement and the pulmonary vein will be engorged. In case of the heartworm disease, you will find right ventricle to be enlarged and the pulmonary artery will be enlarged. Okay, so this is basically the everything about the cardiovascular system. Next we will be go the lung. Okay, discuss the lung. That will be the last class of the radiology. So meet you in the next class. Till then, tata, bye bye, take care.